Good afternoon. Today is Monday, January 25th. I am joined, of course, by Dr. Khaldun, as well as Director Elizabeth Hertel of MDHHS, Phil Knight, the Executive Director of the Food Bank Council of Michigan, and Gracie Harris from Detroit. Today, President Biden is expected to sign a Buy American executive order, ensuring that when the federal government spends taxpayer dollars, they are on Michigan, or I wish just Michigan, but American-made goods by American workers and with American-made component parts. This is good for Michigan, though. These investments will help create good-paying union jobs and build back our economy better, where everybody has a fair shot at the middle class. In Michigan, that means building a stronger state for the thousands of dedicated auto workers who build Michigan-made cars. It means ensuring that our workers earn better pay, better benefits, and more time to spend with their families. From the beginning, I have worked to ensure that more of our Michigan tax dollars are spent supporting Michigan workers and Michigan businesses. I signed the Michigan Jobs First Executive Director during my first year in office to support Michigan businesses that provide fair wages and good benefits. It's the right thing to do. The President's executive order strengthens American supply chains and federal purchasing power to invest in America's industry, unions, and workers. In addition to the executive order, the Biden-Harris administration will act to improve labor standards, launching a process that will require federal contractors to pay their workers a $15 minimum wage and provide emergency sick leave. President Biden is investing in our economy, investing in our workers and our families while making sure that the future is made in America by American workers. And I want to thank him for his leadership. This morning, I announced appointments to the Michigan Bipartisan Protect Michigan Commission to raise awareness of the safety and effectiveness of the approved vaccines. The commission is co-chaired by the Lieutenant Governor Garland Gilchrist, Dr. Joneigh Khaldun, and Detroit Pistons forward Blake Griffin, and many others. The bipartisan legislators on the commission are Senator Winnie Brinks, Senator Kurt Vanderwall, Representative Felicia Braybeck, and Representative John Roth. The appointees represent a diverse array of industries, professions, and backgrounds. This group of leaders is uniquely qualified to help us ensure that every Michigander who wants a vaccine, who's eligible for a vaccine, can get a vaccine. The bipartisan members of this group are going to play a vital role in helping reinforce the importance that everyone gets vaccinated. I'm confident that members of this commission will rise to the occasion and help Michigan end the COVID-19 pandemic once and for all. Additionally, Michigan, the My COVID Recovery Plan that I announced last week includes a direct focus on vaccine distribution. Last month, Congress appropriated $90 million in additional resources for vaccine distribution in Michigan through the Coronavirus Response and Relief Supplemental Appropriations Act. My plan will use this federal funding to ramp up vaccine distribution in Michigan and bring us closer to our goal of 50,000 arms in shots per day. This funding will ensure support for our local health departments for vaccine administration costs, including staff augmentation, as well as provide equipment and supplies. I want to update you on our vaccination distribution efforts as well. Michigan is quickly going up in the ranks when it comes to getting shots in arms. When it comes to doses used, we are in the top 10 in the United States. This graph shows where we are now versus where we were just 2 weeks ago. 2 weeks ago, we had administered 44% of the Michigan-controlled vaccines, with the rest scheduled. I want to repeat that. Administered and scheduled, every vaccine. 2 weeks ago, that was our number. Now, the number is up to 67%. This is good news, and I am proud, as we all should be, of the progress that we've made. I know that people are anxious and ready to get the vaccine, And frankly, that is a good thing. The fact of the matter is we don't yet have the kind of supply that we need. Yet. We do have a plan for 50,000 shots in arms per day once we have the vaccines that we need. Every eligible Michigander who wants a vaccine will get the vaccine. This process, though, is like a locomotive. It is cumbersome and bumpy and slow at the beginning, but we will be picking up steam and things will be going faster. I just ask for patience as our frontline workers are working 24/7 to get the shots that we do have in arms, and for the Biden administration to ramp up so that we can get more shots into Michigan. My plan also supports more families through food assistance. No family should have to worry about how they're going to put food on the table, especially during a public health worldwide pandemic. But as of fiscal year 2019, 1 in 8 Michigan residents received food assistance. COVID-19 has negatively affected food security for so many Michiganders. People have lost jobs. Children who rely on their school for breakfast and for lunch have had to stay home from school. What families need is support from their state and federal government. I want to thank Senator Stabenow for her leadership and tireless efforts to expand access to food assistance, which has brought relief to so many Michiganders in need throughout this pandemic. We have taken many actions during the last 10 months to make sure Michiganders have access to healthy food. I want to highlight a few of them. When the pandemic struck, we acted swiftly to ensure children who relied on free or reduced lunches would still have access to food while they stayed home from school to be safe. You might not know it, but Michigan was the first state to begin pandemic EBT payments last spring. Nearly 900,000 Michigan kids received food assistance through a partnership between MDHHS and the Michigan Department of Education. And thanks to President Biden's recent executive order, pandemic EBT benefits and recipients will see their benefits increase by 15% once the USDA approves our plan. Michigan was also one of the first states to get approval of an increase in monthly food assistance benefits to households who are not already receiving the maximum monthly payment. This helped 350,000 Michigan families who have to worry just a little bit less about affording food during this pandemic. We've done a lot of work in this space, and there still is more to do. For our college students losing their jobs due to the pandemic, it was created a system where some could also lose their food assistance because they were no longer meeting federal work requirements as students. So they would have to choose between college and food. Literally, that was the choice some were making. MDHHS and the Michigan Department of Labor and Economic Opportunity made changes that allow students in college, career, and tech ed programs to keep their food assistance and stay in school. Close to 90,000 students qualified. Last spring, as we encouraged people to stay home, to stay safe, for the first time we gave food assistance recipients the chance to redeem their benefits with online food purchases from Amazon and Walmart. Aldi later joined. Our aging residents are particularly vulnerable to COVID-19, so it's crucial that we give them the opportunity to have food delivered rather than going out in the midst of the pandemic. MDHHS's Aging and Adult Services Agency has taken numerous actions along these lines, working with local area agencies on aging. That includes providing home-delivered meals to older adults while congregate dining sites were closed during the pandemic. More than 46,000 aging adults received more than 6.4 million home-delivered meals from March to September of last year, an increase of more than 8% in meals. And finally, in August, I formed the Food Security Council within MDHHS to develop recommendations for addressing food insecurity during this pandemic. And they've made recommendations that are already being acted upon. So there is light at the end of this tunnel. However, we are still in the tunnel. Thousands of families still need support, and every one of us needs to continue taking this seriously and doing our part. That's why it's crucial that the legislature join forces with me to pass the My COVID Recovery Plan. My plan will ramp up vaccine distribution, support small businesses, and get our students and educators back on track. I can't do it alone. I need the legislature to work with me. We've come together to pass a relief package before, and we can do it again. I look forward to working with my partners on both sides of the aisle to get it done. Now I'll introduce Dr. J.
Thank you, Governor. Good afternoon, everyone. So here's where we are with our COVID-19 metrics. Case rates are now at 203 cases per million, and that's down 72% since our November peak that we saw. Our percent of tests that are positive is also coming down and is now at 6.2%, so that's a good sign. And the percent of inpatient beds that are occupied by patients with COVID-19 is also trending down and is now at 9.2%. I also want to share information about the new variant of COVID-19. We've identified this new variant called B117 that was found in Michigan. There are now at least 13 variant cases that are confirmed in Washtenaw County, and now we know of at least 4 in Wayne County. There are likely more cases that we have not yet identified, and there's possibly spread of the variant that is happening right now. This variant is more easily spread from person to person, and that means that for any given case, it will likely infect more people and lead to more spread. And this means possibly more cases overall, more hospitalizations and deaths. The good news is, though, this variant does not yet appear to cause more severe disease. Our current tests can identify it, and our current vaccines appear to work against it. But this new, more easily transmitted virus is still very concerning. We do not want to have to go backwards to slow the great progress we've already made. We want to continue to reopen our economy and get back to a sense of normalcy. This means that we all have to think a bit differently and more aggressively about preventing the spread. At MDHHS, we're working very closely with our local health departments to prevent the spread of this new variant by quickly identifying any outbreaks, reaching out to contacts, and making sure people are quarantining and isolating appropriately and expanding testing. But there are also things that everyone can do individually to help slow the spread of this new variant and the virus in general. So wearing a mask is still one of the most important things you can do to slow the spread of COVID-19, including the new variant. Last year, MDHHS launched a Mask Up, Mask Right initiative to let people know more about the best way to wear a mask. So there's different types of masks that you can wear. You want to at least wear a multiple layer cloth mask. Masks that have a single layer are not as protective. You can also wear a KN95 mask or a multiple layer disposable mask. And you can also wear a face shield over your mask for additional protection. But please remember that face shields alone without a mask over the mouth and nose are not as protective, so you want to wear both. Your mask should be worn over your mouth and your nose every time you will be around someone who is outside of your household. A mask is not effective if it's only over your mouth or if it's around your chin. And free masks are also available at many of our MDHHS offices across the state and at several community action agencies. The other thing you can do is make sure that you are getting a test. Right now, we are doing about 41,000 tests a day, which is good. Because this variant is more easily spread, we must do more testing so we know where the virus is and we can quickly reach out to people so they can isolate and quarantine appropriately. So if you have any symptoms, if you've been exposed to someone, or if you have recently traveled outside of the country or to a place where a new variant is spreading, you need to get a test. You can still go to our website, michigan.gov/coronavirus test, to find a testing location nearest you. We also still have many staff at MDHHS and at our local health departments who are doing case investigation and contact tracing. So again, if a health department staff member tries to reach out to you, please do answer the phone. We need to get in touch with you to let you know that you may have a positive test or that you may have come in contact with someone who has a positive test. You can also still download our free app, My COVID Alert. This free app protects your privacy and it lets you know if someone you have been in close contact with has the virus. You can download that at our app store or go to our website, michigan.gov/coronavirus. Finally, you can get your COVID-19 vaccine when one becomes available to you. As the governor mentioned, we've made great progress in our vaccination efforts and are now in the top 20 states in the country when it comes to vaccinating Michiganders. We've also already completed vaccinating our skilled nursing facilities and are moving forward with expediting vaccinations for people in other types of long-term care facilities, bringing on additional pharmacy partners. We know that our local health departments, our health systems, our pharmacies, and others are actively working to get people access to a vaccine. And I want to remind people that while we want to get as many people vaccinated as quickly as possible, as the governor said, there's simply not enough vaccines available to our state right now. So our health systems and our local health departments may not have an appointment for you if you call. We ask for everyone's patience, but please do seek out a vaccine when one becomes available to you. And you can go to our website, michigan.gov/COVID vaccine, to find out about vaccine locations. So we still have much work to do, and we all have to come together to end this pandemic in Michigan. And that means doubling down on the things that we all know how to do already. Wear your mask properly, wash your hands, avoid gatherings, and please do get your vaccine. And with that, it's my pleasure to turn it over to Director Elizabeth Hertel, who I've had the pleasure of working with for the past 2 years, and I look forward to partnering with her still to end this pandemic.
I am honored to be here for the first time as the Director of the Michigan Department of Health and Human Services, and I would like to thank Governor Whitmer for trusting me to lead this department that I feel so privileged to be a part of. I have been proud to work alongside our state's Health and Human Services team, serving Michiganders for many years, and I am grateful for the opportunity to lead our future efforts in partnership with my great colleague, Dr. Joneigh Khaldun, our employees, as well as the rest of state government, business and community leaders, and local health partners. I would also like to thank Robert Gordon for his service and support of our mission and his service to our state and its residents. And I'd also like to acknowledge and thank the MDHHS team who has worked tirelessly over the past year, responding to the biggest health crisis we have faced in our lifetime. Today, we are proud to highlight the actions that have been taken to ensure Michigan families have access to food despite the economic impacts of this pandemic. Moving forward, we will continue to do everything we can to ensure that Michiganders are able to have enough food to eat. Our food assistance program is available to help families, and it is one of the most effective tools that we have. It allows families choice in the kinds of foods that they purchase and where they can shop. Currently, this program serves more than 1 million residents, providing over $224 million per month in benefits. The food assistance application process has been streamlined to help make it easier to apply. We have made great improvements to our application process so that people can apply online through our My Bridges website, which is found at michigan.gov MyBridges, or by submitting an easy-to-use paper application. And we have staff covering every region of the state who continue to stand ready to process these applications and provide help to individuals during these challenging times. Additionally, families with questions can also reach out to 211 to learn about resources available locally in their neighborhood and their communities. Another program that has been especially noteworthy is provided by the Michigan Department of Education and our local schools. It's called the Meet Up and Eat Up program, and it allows meals to be picked up for children under the age of 18 at locations throughout the state. We are extremely appreciative of the recently announced changes from President Biden that will further strengthen the resources available to help families. This includes the extension of the 15% additional food assistance benefits that Michigan families will begin receiving this month, and increasing the amount of our pandemic EBT benefits. We look forward to working with his administration to implement these essential supports. I am proud to lead this department, where I can see evidence of the differences made every day, whether it's ensuring Michiganders have access to benefits or food during difficult times, or protecting Michiganders' public health during times of crisis. I look forward to continuing this great work alongside my colleagues at MDHHS and with our community, business, and legislative partners. And with that, I'd like to turn it over to Phil Knight, who is the Director of the Michigan Food Bank Council.
Good afternoon. It's a joy to be here with you. The toxic stress of being food insecure does not confine itself to the beginning and the end of a pandemic, but it does make living inside the worst public health crisis in a century far more difficult. Because in a pandemic, or whether you're in or you're not, if you're hungry, you only have one problem. The stress of being food insecure robs you of the ability to perform, to cope, and to plan. COVID-19 just makes this harder. Governor Whitmer commissioned the Food Security Council to help her understand the impact of COVID-19 on our hungry neighbors. The FSC has learned during these months the pandemic that collaboration across sectors is how we can finally take hunger off the table. For example, the members of the Food Bank Council of Michigan have safely increased their distribution of emergency food by 50% to meet more than a 50% increase in need. This would not have been possible without the Michigan National Guard working right alongside of us. This type of collaboration can happen inside or outside the pandemic with health care, education, as well as other social service programs. But it takes more, and that is why the executive action by the President is perfectly timed. The temporary 15% increase in SNAP will help the most vulnerable among us. It will also serve as a catalyst as the economy re-engages, and hopefully take just a little bit of stress and pressure off our charitable network. The Food Bank Council of Michigan and the Food Security Council believe food security is one of the issues that can unite us. Hunger isn't partisan. It isn't even bipartisan. It's nonpartisan. We know this because we can all agree that two words that should never go together is child and hunger. I'm thankful for this executive action regarding basic needs, and I'm thankful to you, Governor, for remembering our hungry neighbors and investing in them too. Thank you.
Hello, my name is Gracie Harris. I'm so grateful for the extra food benefits that I received during this pandemic. I am a senior on fixed income, and I was concerned how I was going to keep food on my table. Not having access to a food bank, this has allowed me to make it through the month. Our governor is meeting the needs of the seniors like myself and who are struggling to make ends meet. Thank you, Governor.
Thank you. Thank you, Gracie. Thank you, Phil. All right, with that, happy to open up for a few questions.
Okay, great. The first question will come from Kathy Gray.
Good afternoon, Governor. On Friday, Director Gordon resigned pretty abruptly. I'm wondering if you can provide any more specifics and if you asked for his resignation.
Kathy, I want to start by just saying, I want to thank Robert Gordon, and Director Hertel did as well, to lead this department in unimaginable circumstances. It has been grueling, and on behalf of all the people of Michigan, I want to thank him for his service to our state. You know, he worked hard to protect our public health, and the food assistance that we talked about here today was one of Robert's ideas. This is a moment where we now are fortunate that there is another incredibly qualified person at the department who is able to step into this leadership role, and I welcome Elizabeth Hertel as our new director. We have much work to do. Much lies ahead of us, but because of the hard work of Robert Gordon these past 2 years and where Elizabeth is ready to take us, I am confident that we will continue to be a leader in this space.
Okay, we'll go to Jacob Whitmer.
Hey, Governor. Following up on that, can you describe the relationship you had with Robert Gordon? And then number two, I was wondering if there's any way you can set a date certain for contact sports to resume. Thank you. For you.
I don't think I have anything to add with regard to my comments about, the former director. I've shared with you that I wish him well. I'm grateful for his leadership, and we've got a wonderful new director at the department. So we're going to continue to forge ahead here. With regard to contact sports, we're watching the numbers very closely. I think it's important to point out that, as Dr. Khaldun talked about the variant and the seriousness and the high contagious, aspect to this variant, that it's important that we keep watching the numbers. I mean, I understand the concern that parents and athletes have and their desire to reengage, but I'll also point to some events that just happened in the last couple of days with seeing this variant growing in and around Washtenaw County and around the University of Michigan campus. I want to commend the University of Michigan for taking the actions that they did. We think that those are the right steps to keep people safe, and our job is to try to curtail the spread of this new variant in Michigan, and we got to not let our guard down. We've reengaged restaurants to a certain extent. That will increase the amount of people that are out and about, and I think it's important that we stay very focused on where the numbers are before we take additional steps.
Hey, Governor, the next question will come from Dave with the Free Press.
Dave, if you're speaking, I can't hear you. You're on mute, maybe.
Can you hear me now,
Yes.
Governor?
Yes.
Okay, sir, I don't know what happened there. I'm sorry. We've talked a lot about vaccine distribution administration. Can you provide an update on how many providers are hitting that 100% administered goal within 7 days, and what exactly those providers are doing in order to, close, kind of shorten that gap?
Sure, Dave. I'm going to hand that over to Dr. J.
Yeah, that's a great question. There's no question that the reason why we're seeing the improvements we are is because of the work of our hospitals and our local health departments. I think it's just really a matter of logistics, and people are scheduling appropriately. We're getting more vaccines in arms. They're figuring out how to do this most massive vaccination effort ever. I don't have the exact numbers on the top of my head of how many providers are meeting that metric, but there's no question that many of them are. And again, every dose that we have access to is either in an arm or it's scheduled to be in an arm, and they're all driving towards that 90% within 7 days goal.
Take a few more questions. We'll go to Rick Alvin at this time.
Thank you, Governor, for taking this question. I apologize because you said you had nothing more to say about it, but I think some of us are still wondering the answer to Kathy's question. Did you ask for Director Gordon's resignation, and was this expected at all?
Rick, I've answered that question. I think the only thing that I would say is, it's been a grueling couple of years, and changes in administrations happen. I think I wish Robert Gordon the very best. I truly do, and I am incredibly grateful for the hard work and the way that he showed up every single day over these last 2 years. It has been a long impossible to imagine experience, and I'm grateful that we had his leadership for 2 years, and I'm wishing him every best of luck as he moves forward. I'm also grateful that we have someone of the caliber of Director Elizabeth Hertel here in Michigan in the department who can step in and help us navigate this next phase of COVID, because certainly there's light at the end of the tunnel, but we're not out of the tunnel yet. And so Dr. Khaldun is phenomenal, and we've been so fortunate, and we're going to continue to work well together as we move forward in this to end this pandemic.
All right, Governor, we'll go to Eric Lloyd now with 9 and 10.
Hello, Governor. I was just wondering, a few weeks ago, we had asked if the state was holding back the second dose. That was when we thought the U.S. government had reserves. So now that that isn't the case, is the state responsible for holding back vaccines for the second dose, or are we giving them out as we get them?
I will, again, ask Dr. J to come to the microphone. There is a method by how vaccines are ordered and how they are administered, and she can shed a little more light on that.
Yeah, so at the state, we are not holding back any doses. There's no storage unit anywhere in Lansing that's holding vaccines. So what we're doing is we are making sure that every entity who put a shot in an arm, they get the right amount of shots. Either it's 3 weeks for Pfizer or 4 weeks for Moderna. They get that amount so that they can make sure those people who got those vaccines, that first dose, get it when they need it. So we're not holding back any vaccines at all in the state. We're giving them out as soon as we get access to them.
Okay, Governor, the last question will come from Julie Mack with MLive.
If you're speaking, you might be on mute.
Okay, well then we'll take the last question from Tim Skubic.
Governor, if the Senate Republicans hold your nominee to the department hostage in return for you relenting...
Thank you, Governor.
I'm sorry, can you hear me, sir, ma'am?
Hi, thank you.
We'll take the last question from Tim Skubic.
Oh, shoot.
Can I start again?
Okay, I just, so what we'll do is we'll go to Julie Mack, and then Tim will end with you. So Julie, go ahead with your question.
Julie appears to be on mute.
Go ahead and go to Tim Skubic, and we'll end there.
Governor, if the Senate Republicans hold your nominee hostage and not confirm her unless you reopen the economy, one, would that be wrong?
Can you hear me? Can you wait?
Go ahead, Skubic. Finish your question.
Okay. You get where I'm going with this? If they try to play this game with you, will you warn them not to do that, or would you trade off releasing the nomination so you get her confirmed in return for opening up the economy?
Okay, let me start with the premise of the question. The economy's not closed. Things have not been closed for 8 months. It's been different. It's been, I don't mean, and please, I don't want anyone to hear me saying that I don't take seriously the sacrifices that people have made. There are certain aspects of our economy that have heightened risk. When you take off your mask and you're indoors, combining multiple households, that's a heightened level of risk. And so certain aspects of our economy have not been fully engaged. We are moving in a direction where we have increased engagement in the restaurant space, as an example. I think that our numbers, as you see, if you look at the numbers and compare Michigan to the rest of the Midwest, and most of the country for that matter, we're in a stronger position because we've taken this pause. We're able to take this step, but we are also very mindful of the fact that this variant is now here in Michigan, and it poses a very real threat. That's why we have to continue working very closely with our hospital systems. We have to continue working very closely with our experts in public health and the people that are doing this incredible work on the front line all across Michigan to make sure that as we re-engage things that it is safe to do so and we don't run the risk of looking like a lot of the states that are our neighbors, frankly. There are states in the Midwest that are not doing non-emergent surgeries right now. But the last I heard, they weren't. I cite that because that's not the case here in Michigan, because our actions have worked. And so whether it is contact sports or it is bumping up that number for in-person dining, I mean, these are actions that will increase contacts and could create spread, and that's why we have to be really smart and incremental as we move forward. We're making progress. We are the envy of many other states. We have to be mindful. And so bartering public health restrictions with the legislature for nominees. I've not done that for 10 months. I'm not going to start doing that now. We have to follow the science and listen to the experts. All that being said, I'm hopeful that it was just an off-the-cuff remark, because there are a lot of really important nominations that need to go through. We've got a lot of boards, we've got a lot of important leadership roles that I'm hopeful the Senate won't just cross their arms and not see these confirmations go through, because we've got serious work to do, and I hope that each of these nominees gets the full and fair consideration that the Senate would give in any other moment of time.
All right, great. Thank you, Governor. Thank you, everybody.